Mary Gladys's life work has been and is making access to healthcare financially easier for hundreds of people for whom access has been and continues to be difficult. Even before Congress passed the Affordable Care Act in 2010, the Cuyahoga County Commissioners were concerned about this lack of access to health care for particularly the poor, the homeless, and the uninsured. The Commissioners collaborated with the area's 4 major health systems, the Cleveland Clinic, Metro Health, University Hospitals, and St. Vincent Charity System, to create the Cuyahoga Health Access Partnership, CHAP for short. CHAP, with its health coverage offering the Access Plan, was formed as a solution, even if short-term, for the uninsured with urgent needs for health care. The Access Plan would cover health care for up to 6-month periods, and it could be extended. Mary Gladys, who represented Cleveland Clinic at that time, was appointed the administrator for the Health Care Access Plan. Under the Affordable Care Act, passed in 2010, CHAP became one of 9 agencies in the state of Ohio under the umbrella of the Ohio Association of Food Banks to be designated as navigators and/or certified application counselors. Mary became a navigator with 5 others under her. CHAP became the go-to agency in Cuyahoga County to help individuals access the marketplace and also care under Medicaid. CHAP, under Mary's leadership and working with the county, spearheaded the Northeast Ohio Enrollment and Outreach Council, which brought area agencies together to keep abreast of all activities surrounding access to health care. In 2015, Mary became director of CHAP, leading the team of navigators while continuing to administer the Access Plan. She set the example for us navigators for serving our clients, being thorough, knowledgeable, always listening, patiently and carefully, always thinking of every way we could help as many people as we could in the best possible way we could. Her work ethic was also an unspoken example to all of us. Up at the crack of dawn, Mary always made herself available to us, anticipating what we might need to do our jobs well, yet always concerned about us as people who had lives to live and families to care for. 2017 was a difficult year for healthcare and for CHAP. Changes to the Affordable Care Act resulted in loss of funding to the navigation program and for agencies like CHAP, which went through a period of transition, going briefly under the Center for Health Affairs and then in the latter part of the year being taken over by MedWorks USA. In the last 3+ years since 2017, CHAP has been dissolved, but under Mary's guidance and leadership, working with Jen Andrus, MedWorks' executive director, navigation services have expanded and have become a central part of the care and connectivity services MedWorks now offers to the greater Cleveland community. Mary, through it all, has remained Mary, quiet, calm, considerate, kind, always thinking ahead and outside the box for her team. For all of us who have gone through these very uncertain and sometimes scary COVID times, those are precisely the qualities that are called for in leadership. Going the extra mile is who Mary is. She has carried us through these times, caring for each of us under her supervision and each and every person who is in need and comes across her desk, just as though we were family. And if you know Mary, family is everything to her. So it is with pride, gratitude, and joy for all that she means to our MedWorks team that I introduce to you my friend and my sister in spirit, Mary Gladys. UHCAN Ohio proudly honors Mary Gladys.
Good evening. I would like to thank Steve, Charlotte, and everyone at UHCAN Ohio for selecting me as one of your honorees this year. I can't tell you how much this means to me. to be recognized by one of Ohio's leading champions of healthcare access. It is truly, really appreciated. No one is alone when doing this work. So many others help us along the way. They share their knowledge, keep us informed of issues and pending legislation, motivate us to become more involved. Many have helped me. The first person I would like to thank is Jen, my executive director at MedWorks, for her support, her vision, and her extraordinary leadership ability, especially during this past year. She met the challenge of keeping our organization on track, finding new ways to help the underserved. Thank you to my team, Chitra and Charles. We've worked together for over 5 years and have weathered many challenges. They are caring, dedicated individuals who are amazing. Quite simply the very best. I feel lucky to have worked with both of them. Lastly, I'd like to thank Rachel for her support. I never really said how much I appreciate you, even when you pushed me to take on something beyond my comfort level. Your hard work, knowledge, and passion never failed to amaze me. I'm grateful for your kindness and guidance, but mostly, I'm fortunate to call you my friend. Assisting people with insurance enrollment and access to medical care has been our role for the past several years. I found education to be a key factor also. I remember working with a person right after the first ACA open enrollment period started. He was putting off treatment for a severe medical condition because he was concerned about the cost and if he would even be treated if he didn't have insurance. Once I learned his age, I asked if he ever thought about Medicare or enrolled in Medicare. He honestly seemed very confused by the question. So I asked if he had a red, white, and blue card in his wallet. He not only had a card for Medicare, but Medicaid as well. He had no idea what the two cards meant. We talked at length about each card, how to use them, and the services they covered. We were able to schedule an appointment at a clinic near him for later that week. We worked on and off together for the next couple of months, answering his questions and ensuring he knew the benefits of each card. Insurance is complicated for most people, especially so for those that have never had it. In closing, I remember hearing, if you love your job, you will never have to work a day in your life. I have been very blessed. Thank you again, UHCAN Ohio.